Sweet. Okay, so when working in the abdomen, the most advantageous position is supine because the abdomen is exposed, free to move in the planar planes required, and visible. Lateral and seated are available to you. Don't do prone because it's in contact with the table, and then it gets creepy because you're reaching around. So please don't do that. When working on the abdomen, it is very, very difficult to actually be sure which structures you are on. Other people will claim otherwise. That's okay. They're allowed to claim that. Without imaging, you do not know if the person has situs inversus. You do not know if the person has very, very normal variation in abdominal anatomy. It is very normal for things to be in a wide variety of places, and there is movement within the abdomen. With respect to wherever or however a person's built, it's relatively stable, but you don't know how they're built internally. You do not use fingertips. You use as broad contact as you can. There is a time when you can use fingertips a little bit, and it's when you're working the colon. I put that in air quotes because you're likely doing it, but you may also not. It just depends. Like a normal variation with the sigmoid, as I had told you, you'll see this in netters. So the sigmoid is essentially supposed to be in the left iliac fossa, come to the middle and go down. But it will come to the middle, go back up, and then come down. It will come all the way across and back. Those are normal variations. You're not sure. So what you're better to look for and be more accurate with is just resistance or like lack of yield to pressure. The easiest way to figure that out, either they're a push-pull, and that's always a problem depending on the side that you're on, but a simple 4-quadrant test is going to be useful. So depending on where you are and what side, you're just looking for yield, right? So no big problem there. That already feels a little funky to you, okay? That could be better. And then my hand has to change. This is okay. So basically that side. Right, so there's stuff on that side. There's a lack of yield to pressure. Now my options for leverage are going to be the ribs, the pelvis, and the leg. What you will find is that if you use the same side leg, it works. If you use the opposite leg, you don't connect. Right? Did you all find that when you were practicing and when you were trying to come up with stuff? Yeah, the opposite leg doesn't work. Double legs, don't do it. It's just a lot of work. So I am going to come over to the side because that's... Actually, you know what? Put your head up there. Yeah. Swing around. Thanks. Yay. I don't normally do this. So I know that I've got an amount of tension on this side. Interestingly, it's about there, right? So broad contact for multi-point discrimination. As I push in, here's fine. Here's a problem, right? So there you go. So if I'm high up there, my most likely good lever to take tension off of this, and you would prefer to take tension off of it as opposed to stretch and reef and be mean. Okay, so this takes a good amount of tension because essentially what I'm doing is I'm compressing the ribs towards the midline, which based on attachment points of all of that tissue, it should relatively shorten it, right? So we're being very, very general. Now my fingers are outstretched on the abdomen, but I'm not poking down with the fingertip. Is that fair? Okay, I'm just kind of monitoring. Now, the video will show that there is some blanching of my fingertips, but it's mostly because the abdomen's going to move around, right? So it's like the abdomen is more or less moving around my fingertips, so it's putting a little pressure on me, right? And I don't, it's minimal. And I don't make him exaggerate his breath, right? I just follow it. Right, so none of you see me overbearing on any of this. The initial was a decent amount of compression to get the ribs moving, but you don't really see me adding anything to it. But you feel, every time you breathe, I just take a little bit more. So as you breathe out, I just take a little bit more, and I try not to let you off. Right, I try not to, as he breathes in, let my hand really move with him. Just kind of hold on to him. All right. So on video, you'll actually see this, I think. I think it'll show up okay. Right, and it's just waiting. So if we were to buy into the standard visceral concept, I could either be working on the diaphragm, I could be working on likely the stomach or the spleen, because it's a little more lateral on the common costal cartilage. People would say it's the spleen, or maybe because it's a little low, it's the pancreas. How do I know? Right, I really don't know. Now, what'll be interesting is if I move out slow, when I do, you'll see how far I've been able to move, right? So as I move out slow, right, decent amount. None of that felt overbearing, right? So I just kind of go back in here, right, in here, in here. It was, yeah, feels different, right? Just real easy. Now, were I to attempt to use the leg, now I run into problems because I got to do this. I got to get a little twisted. Right now, if I use the leg to soften, just even like, does that do much there?
No.
No, it doesn't do much there. It's high. It's high in the abdomen. Now, were I to do this, does a little something, but the ribs do more. Right? So now what I want to do is come down into this lower quadrant on the left and just see if there's anything left over. Not there, but about there. You feel something. So just based on leverage, that'll do something, right? Now if I mark the spot and switch hands, that does more.
Yeah, it feels like it comes off.
Yep, comes off tension. I'm just trying to soften it up. So really what I'm looking at is yield to pressure. Now, if I pushed into his abdomen and it didn't hurt when I pushed, and I let go and it hurt when I let go, what's that called? Rebound tenderness. Anytime you identify rebound tenderness, what do?
Refer out.
Refer out, right? That's a red flag. That is an abdominal pathology until proven otherwise. Now, you'll notice, maybe you don't see, this is physically harder on me, especially on my left arm using the pelvis, right? Like, my hand is getting warm because I really have to lock the elbow out because the pelvis doesn't really yield the same way with the breath. I work more for this, right? You may or may not notice that. Like you can tell I'm working a little harder.
Yeah. Certainly harder than here.
Yeah. I need to use more force because it just doesn't move as much, right? Well, see, I got a decent amount of movement out of it. Just to compare and contrast, do this. Does that do more, less, the same?
As pushing on the pelvis?
Yeah.
Like less.
Less, yeah. Right? Now if I do this, right, see how that kind of like puts tension on it?
Yeah.
Right? If I do this,
it comes on.
Yeah, right? Like it does stuff. You just got to know how to use the leverage and actually pay attention to where your hand is. But let the leg down. So the leg is an option, but the leg is going to put more work onto me, right? So we got that. It was this area, right? Yeah, let you have a normal breath, right? And I'll use this hand because this is the hand that I used. Different, right? So what we're looking at really is soft tissue work or approximated soft tissue work. We can start to tell stories in here, but if you look at visceral textbooks, that's what you're going to see. Sometimes they prefer it when you stand and you basically do a leg rotation. The problem with using the leg is that sometimes by changing the relationship between the femur and the abdomen, you'll actually put tension on it. So you really got to work sometimes. If you're standing up, you tend to crowd yourself. So if I'm in here and I find whatever spot I want to find, I start to do this, my hand can get crowded, right? Like, let's just say I'm looking for this one, right? This finger here. Right. Like I can't, like it's just harder work, right? Now, if I just did it, say with the leg, and I was here, and again, I'm looking at this spot, that's more of it, right? So depending on position, you've got to be willing to try different things. But essentially, you're going to treat this like it's soft tissue because it's soft tissue. Organs are soft tissue. They just happen to be smooth muscle. You can't appropriately identify them. Unfortunately, no matter what people want to claim, if you go ahead and you talk to people who cut abdomens open on purpose, they may laugh at you when you say that you can palpate the organs properly. I promise they'll laugh at you because they're highly varied. Even though it's a relatively stable blueprint, the stuff is variable. So anyways, sweet, thank you.